welcome to another DPI COVID-19 update for Thursday, October 1, 2020. I am Delicia Hayes, and today we will be speaking with the Honorable Minister of Health, Dr. Frank Anthony. Dr. Anthony, thank you for joining us.
Well, thank you very much for having me in your program. Government has been doing quite a number of things. We have a health response. We also have a socioeconomic response. And we have been putting these two together so as to assist the population as a whole. With the health response, we have spent a lot of time trying to build capacity. That is our capacity to be able to test more people, our capacity if people get sick, that our hospitals are ready so that we can provide treatment for persons who are sick, and not just in the general wards, but in the ICU as well. So we have been able to equip our ICU at Georgetown Public Hospital, both with equipment and medication. And we are right now working to equip all the regional hospitals so that they too can have their own ICUs and trained personnel. So this is work that is ongoing. In addition to building the capacity of the health system, we have also been doing a lot of work in terms of talking to people, doing some risk communication so as to communicate to the general population about what is happening with the disease in Guyana, and also what steps they can take to prevent this disease. So that has been an ongoing work that we have, and we have been collaborating with various partners to get that message across. In addition to that, when we find somebody who is positive, we work with them to ensure that they are properly isolated. So you have two options in terms of isolation. One is to either put them in an isolation facility that is run by the government, or the option of isolating at home. Both of these options, while they are available, an assessment would have to be done to determine whether that person can be in institutional isolation or stay at home. And even if you stay at home, then there are certain requirements that you have to undertake, and we have staff that would regularly call to ensure that you're doing okay. If perchance somebody who has been in home isolation is getting sicker, then we are able to send the ambulance or send a team to pick them up and bring them to one of our hospitals. So that's on the health side. We have been doing quite a lot of work on the health side. In addition to that, we have been working with various international partners to ensure that when a vaccine becomes available, that Guyana would also get that vaccine. And so we have signed up with the COVAX facility, and COVAX has been examining about 15 candidate vaccines. They are looking at which one of these vaccines that are currently in the phase 3 trial, which one is more promising, and once they pass through the phase 3 trial and shows efficacy, then they would fund that vaccine to go to the stage of manufacturing, and the Guyana would benefit from those doses once they're manufactured. So we have had these ongoing discussions with the COVAX facility, and we are one of the countries that have signed on to that. So it's looking at this thing in various components and building our capacity. So on the health side, we still have more work to do, but we are in a better place than we were maybe a month ago. And as we continue to build capacity, we'll see more improvement in this direction. In addition to that, we have expended a lot of resources in acquiring personal protection equipment for our staff, the frontline workers who on a daily basis would be meeting with people who are infected with COVID. So we have been providing them with N95 masks, we have been providing them with gongs, caps, shoe covers where necessary, face shields, and so forth. So that's an ongoing exercise that we have. especially for those who work in the ICU areas. So we're at that stage where we have a number of these things available, but we have to constantly replenish because, as you can imagine, uh, a lot of this stock is being used constantly. And so we have been working on that, but we want to assure everyone that our health workers, their health comes first, and we want to ensure that they're properly protected. On the economic and social side, uh, as you know, one of the budget measures would have been the distribution of 25,000 Guyana dollars per household. And that exercise has started, so we have been in Region 1 and Region 9, and that exercise is going to continue to ensure that every household in Guyana gets that $25,000. So these are measures that we're working on, and it would not solve all of the problems, but at least it would help to alleviate some of the difficulties that people are having. And on the socio-economic side, the United Nations have just completed a study of a number of Caribbean countries, inclusive of Guyana. And one of the things that the study did was to compare what happened with people in April and what is happening with them now, or as of June. And what we found is that disposable income for people has been drastically reduced. A lot of people have lost their jobs. Of those surveyed, a lot of people have lost their jobs. A lot of people are not getting full employment. Food stock in people's home has been drastically reduced. So, for example, in April, where maybe about 6 or something percent were able to experience or have at least 1 week food stock in their home, that number has been drastically reduced now. So that study, it's really informative, and it shows how people are suffering in the country because of some of the measures that were put in place. And therefore, it's creating a challenge for a lot of Guyanese. So people might have been on the borderline of poverty. Some people had jobs and they were, able to get by. But now if you don't have a job and you're not getting any income, your family can easily slip into poverty. And there were cases in the survey where they estimate at least about 5% of the persons who were surveyed don't get a meal when it comes, during the day and so forth. So these are things that we have to bear in mind. And when we were designing the new set of measures in this current guidelines, we took not just the epidemiological picture of what is happening, but we also try to factor in some of the socio-economic issues that is happening with the country. And this UN survey served as part of the guidance in crafting the new measures. And that is why you're seeing us reducing, but not removing, the curfew measures. We have reduced the hours, so it's now from 9 p.m. to 4 a.m. Some people might ask why 4 a.m., but we have received in the past a lot of complaints from truckers who would go up for sand or other things, because generally they would come, and people who distribute stuff, generally they would come to work early, get on the road early, and start their distribution. And because of the measures, they couldn't start that until 6, and it actually caused more crowding on the road and stalling of traffic and so forth. So that was one of the things that was considered for the early morning, starting from 4 a.m. And extending to 9 p.m. In the evening also had economic considerations. So between these two things, we're hoping that we can address some of the issues that were raised in the UN survey. And It would not solve all the problems that people have flagged in the survey, but certainly it would help to alleviate some of the issues that they raise. Another thing that we have in these current guidelines have to deal with we're looking at the airport and measures that we need to take in terms of international travel. So while the airport has been officially closed, we were still allowing flights to come into Guyana, and those flights were coming in under some very strict measures. So we have had from March to now to be able to develop systems that are compatible with the COVID-19 environment in which we are living. And so one of our requirements when those flights were coming in is for a person to have a negative PCR test. And then when they get here, they're scrutinized by Port Health, and after that they go through a number of measures, and then they're placed in self-quarantine. As we start thinking about opening up air travel again, and we have set a date of the 12th of October for that opening up, we have added new measures. So in addition to the requirement that someone coming in must have a negative PCR, we have another measure that when they arrived in Guyana, if that PCR test was more than 72 hours, so they had that done 5 days ago, it would mean that they have to get a second one at the airport. So when they come in, we'll have staff there that would be able to take off a sample from that person, and that person would not leave the airport until that sample is processed. So the sample would be taken from all passengers who have this thing less than 72 hours, and they would be processed, and having been processed, they will get back their results before they can leave the airport. So these are new measures, and in a way it's much stricter, and we have a number of companies that are working to ensure that these measures are going to be in place. So with the opening up, and by putting these measures in place, if we detect anybody that is positive, then we can take additional precautions. And of course, if there's a positive passenger, then we'll be able to isolate them and take a whole set of other measures that goes with that. So these were two major changes that we have put in place, and there are measures to ensure that we can bring a balance in terms of protecting people's health and at the same time protecting people's livelihood.
Okay. So, Minister, as a follow-up to the second test that may have to happen at the airport, would this is a PCR test, right? And this
Yes.
would be that test that takes about 2 hours to process?
It's a PCR test, and once a sample is taken and processed, people would get back their results almost the same day.
Okay,
So they'll have to wait a little bit until that sample is processed, and then they'll be given their results. Once they're negative, they're clear to go.
And the airport has the facility to accommodate them as they wait.
And the airport would make those allowances.
Okay, Minister. So, and with the measures that are in place from October 1 to 31st, may I ask, are your expectations from the Guyanese public as we go through this month and as the government is thinking to open up the country?
Well, the measures here, everybody got to take on responsibility. We keep repeating this. This here is a collective task, and every citizen of our country got to take on their responsibility. That responsibility lies with how we behave. So, one, if we have signs and symptoms of COVID, then we need to come to a hospital. We don't need to stay home. We need to get someone to look at you, to make a diagnosis, and be able to get treatment if that is necessary. When you have signs and symptoms, if you have those signs and symptoms and go about your normal business, you are endangering other people's lives. So that's an important thing. If you have signs and symptoms and you go to work, you're putting your co-workers' lives in danger. So that's important. Now, there's a category of people who would have what you call asymptomatic persons, meaning that they don't have any signs or symptoms. Those persons um, can get the virus and spread it, and they don't even know that they have the virus. And that is why it is important that all of us, we wear masks. Because if we have on a mask, then, and say I'm infected and I have on a mask, if I cough, if I sneeze, it is captured in the mask. So I am not infecting persons who are near me. And if the next person got on a mask, then even if something escapes from my mask, right, and it gets out there, the other person is protected because they are wearing a mask.
Correct.
So because we are both wearing masks, you reduce the spread and the transmission does not occur. And that is what is important. And if you stay 6 feet away from each other, then it's hardly likely that you can get infected, because now you both have on masks, which reduces droplets or aerosols from passing through the mask, getting out there. And secondly, the distance that you're standing would also be protective. So these measures, people have to start thinking about them, utilizing them, not just knowing them, because one of the studies that we did is telling us that people know what to do, but applying it is the problem. So if you talk to them about a mask, they know about masks, they've seen people wear it, and why are you not wearing it? That's the big question. So you know all the things, you know that it's protective, but you're not wearing it. So we have to get everyone complying with wearing the mask, because this is important, and this is what would save life. We have we have a lot of people who have died in our country so far from COVID-19, and some of those deaths, if persons have taken precautions who were around those patients, if the patients themselves probably had taken precaution, we probably might have had a different outcome. So we have to learn from experience. We know that this thing, a percentage of persons would end up in the hospital, and a percentage of those who are in hospital would end up in the ICU. And if we know that, then we all have to take precautions. And that basically is what these measures that we've put in place, we want to see that happen. We have some, in the section dealing with mask wearing, we have elaborated a little bit more about what is meant by that. And in that section as well, we have made certain exemptions. But there are very, very few exemptions, because there are some people, because they have some respiratory illnesses and so forth, it might be difficult for them to wear masks.
Yeah.
But other than those persons, every other citizen in this country should be wearing a mask, especially when they are out in public, when they're in closed spaces. They need to do that so that they can protect themselves.
Yeah.
And that's what these measures are talking about.
Definitely. The Minister, before we close off, I just wanted to go back a little bit quickly about the ministry's strategy and how they're mobilizing and all that. You spoke about the ministry collaborating with UN agencies and other agencies in these things. How are the regions on board, and how are they, reporting and keeping abreast and managing the situation in their respective regions?
Each one of the regions, we have a regional COVID-19 task force that is headed by the regional chairman of the region. So they have that political leadership. And in that task force, you also have prominent businesses and other functionaries of the region, along with the regional health officer. So the regional health officer is the person responsible for the overall health administration of those regions. And under them, they have doctors, nurses, and all the health personnel and so forth. So they command the health resources of the region. Every morning, we have a meeting that's from this central ministry. We do a meeting with all the RHOs, and we review the last 24 hours, every single case that we have had over the last 24 hours, and the steps that we are taking or we will take to ensure that those persons who have been diagnosed as being positive, that we take steps to ensure that we can treat if it's necessary, or if they have to be isolated, or what action we will be taking with those persons. So this is an ongoing exercise. First thing in the morning, that's what is being done. And so everyone who is involved in the health response are on that call, and they are aware of how to treat and what is happening in every single region. They also know what is going on with our quarantine facilities, isolation facilities, surveillance. So a lot of information is shared, and by doing that, people are made aware of, some of the best practices that one region is doing and what they can do in another region. People share experiences in clinical management of cases, and what they are seeing on the ground, and sometimes what are some of the other comorbidities that they are seeing in some of these regions. So it is a rich experience, and that is shared every morning. And I think it's quite useful for the RHOs to know what is happening across the country, not just in their region.
Great. Thank you very much, Minister. Okay, there you have it. We just had that update there from the Honorable Minister of Health, Dr. Frank Anthony, and we'll be doing this again tomorrow. So do stay tuned and stay safe, Guyana.